The Brisbane lockdown is expected to be extended. Let's have a look. Hello everyone, Florian.heise here, and welcome to another episode of HeiseSays. Grab your stein of coffee, because I want to have a look at a few articles. We'll look at this first one from news.com.au, and this is live breaking news. Is it really? We'll have a see. Brisbane lockdown almost certain to be extended. The snap lockdown in Queensland was supposed to be coming to an end tomorrow, but it doesn't look like that will be happening. Millions of Brisbane residents are almost certain to remain in lockdown through the Easter long weekend, with infectious disease experts expecting an extended lockdown to be announced tonight. So we'll have to see if that comes out tonight, guys. I would not be surprised. I'd be disappointed. And remember, infectious disease experts, epidemiologists, used to argue against lockdowns. Look on my channel, look at the video, disease mitigation. This isn't the first time through history that people have suggested these huge interventions. And I honestly think our politicians don't care about business, don't care about the economic consequences of what they're doing. But I think there's actually a slightly more woke reason why we're having these lockdowns. And just look at our leader here and see if you can guess what that could be. Because we'll get to it in another article. Infectious disease physician, Associate Professor Paul Griffin, told the Courier Mail if there was an increase in cases today, an extended lockdown would be inevitable. You can read more about this in the blog below, and we'll have a look at that. So here, millions of Brisbane residents. Griffin, yep. I think they're going to obviously wait until the last minute, Wednesday, to see what the numbers look like overnight, he said on Tuesday. And remember, we had that young guy who was accused of having a party. They took him to hospital. He's on TV talking. He's trying to defend himself because they lied about him having a party. He doesn't look that sick. He's young. Then there's a little thing we'll see soon. Guys, come on. That's a bed for someone who may need surgery. So, my gut feeling is, if we get similar numbers to Wednesday as we have today, then we will go for another couple of days. Another 8 locally transmitted virus cases was announced on Tuesday, as the Premier confirmed 2 separate clusters were spreading in Queensland. The first cluster is linked to a Princess Alexandria Hospital doctor who tested positive on March 12th, which sent the hospital into lockdown on Tuesday evening. The cases linked to the doctor include 2 men in North Brisbane, the brother of one of the men, and 2 colleagues of the other. Genomic testing is underway to confirm that the 2 cases are linked to that cluster. The second cluster is linked to the PA hospital nurse and her sister. And if we jump here, we can see the PA is in lockdown, everyone. The Brisbane hospital has been placed into an emergency lockdown as the city grapples with a serious COVID-19 outbreak. So is this to do with staff at the hospital? Is it just a failure in Queensland's health path? I'm seeing reports that the state has enough vaccines to inoculate all of the health workers, but haven't deployed them yet to all of them. That seems odd, doesn't it? If that's meant to be the cure-all and panacea to everything. Meanwhile, staff at another hospital have sent staff home, including midwives and doctors, after a recent visitor tested positive to the virus. The PA was locked down on Tuesday afternoon following an alert to staff. Patients are being diverted to other hospitals, but PA will still accept critical and Category 1 elective surgery patients. At least 1 new case recorded today is linked to the hospital. Staff were told in an email that if they had worked at the hospital campus from noon today, to not work at another Metro South facility until the lockdown was removed. Staff who worked at Ward 5D since March 18th are also being urged to get tested immediately. If you've been in Ward 5D since the 18th of March, then you should be tested and receive a negative result before working in another facility, the directive said. The lockdown will enable the hospital to put in place processes to manage the crisis. The hospital is the source of 2 cases that forced Greater Brisbane into a snap 3-day lockdown. An unvaccinated PA hospital doctor, along with 2 others, tested positive to COVID-19 earlier this month. The doctor was infected by a hotel quarantine guest who had the UK strain. That person is also believed to have infected another hospital quarantine guest, even though their rooms weren't adjoining. Well, doctors do rounds, guys. It happens. So, but has anyone died? You've got to realize, if you look at, well, I'll bring it up. I'll bring up the Johns Hopkins, because this scares people. Fear moves at the speed of light, everyone. Fear moves at the speed of light, and that's why it's such an effective tool for winning elections. And we'll have a look here at this map. And there are going to be some scary numbers here, but there are also going to be some very encouraging numbers here. And we'll have a look. We'll look here. Global recoveries. Okay, there's global deaths, 2.7 million. Global recoveries, 72 million with change. Focus on this number, everyone. If you're feeling depressed, if you're in a lockdown, if you're frustrated with just the other incompetence that's coming from our bureaucratic class again and again. Focus on this. Okay, you antinatalist greenies that want, mankind to be swept from the planet and just nature to return. This ain't your dream. It's not going to happen. Humanity will survive. Always does. We're annoying like that. So, Anastasia Palaszczuk said the lockdown will be reviewed on Wednesday. However, the next 2 days will be crucial and will depend on how many more cases are seen in the state, whether they can be linked. Everyone's worried, but the good news is so far, so good in terms that they're linked. Okay. What we don't want to see is unlinked community transmission out there, so the next 2 days is critical for our contact tracers to get on top of this. The federal government on Tuesday declared Greater Brisbane a hotspot, with Chief Medical Officer Paul Kelly saying the situation was escalating. I can't predict what's going to happen in the next week or two, Professor Kelly said. What happens now in relation to lockdown and very strong public health action hopefully will get on top of this. But at the moment, those numbers are increasing. Meanwhile, Mater Mothers Hospital has sent staff home, including midwives and doctors, after a recent visitor tested positive to the virus. I remember last year when Edward was born, that's when we went into the Mater Mothers. It's where we have our children, or Rachel has them and I watch. And it was interesting just seeing the protocols they had all in place, how to manage it, and you were pretty much isolated from the other parts of the hospital too, because, they're extra careful around the babies. It is understood the person visited the private maternity section at a nearby cafe that staff frequented. Where you pay $8 for a coffee, guys. And you don't care. I don't care. Well, I'll happily pay a fortune for hospital coffee. But we don't actually do the private one. We do the public, but the midwife program they have there. And it's fantastic. Rachel has all of this. You get meetings pre and post birth, and you're usually out, without complications, you're usually out on the same day. Now, with Edward, because he has Downs, Rachel had to stay in the hospital for a few days, and they just put her up in the private section. So I'm very impressed with Mater, with the care they give mothers and babies. It's very good. If you look, you're looking to have a baby, if you're bored in lockdown and looking for someone to do, have a baby, guys, and then go to the Mater Hospital, Mater Mothers. Highly recommend it. We're 5-time veterans there. I remember, I'm going off topic like I always do, but I remember when we had our first kid, and Rachel was there relaxing afterwards, and I went and got a coffee. And I talked to this other guy there making a coffee, and he said, oh, yeah. I said, oh, I'm here for my first. What about you? And he said, oh, yeah, number 5. And I looked at him shocked like he was some freak. Now that's me. Fantastic. Anyway, back to this. More than 2 million people live in Brisbane, Moreton Bay, Redlands, Logan, and Ipswich. So they can only go outside for essentials, for medical care, to exercise and to work, and to study if they cannot do so at home. Professor Kelly urged people to practice physical distancing and good hand hygiene ahead of the Easter long weekend. Now look at this. He's right here. We should practice social distancing, but there's a particular, I would say, class of people that you should practice social distancing more than others. Let me know in the comments if you think you figured it out. Remember that photo of our glorious leader? What do you think it is? What do you think it is? The virus has not gone away. It is circulating. We know in the Brisbane area at least, so people should take these precautions of the COVID-safe behaviour. So let's have a look at what I'm restricted to do, because I live in Brisbane, guys, of course. Regulars will know that. And, you know, we're not travelling long distances to go to the Mater. So 4 reasons to leave home: to purchase essential food and medication, for essential work, to exercise in your local area, to provide help, support, or healthcare. So hospitality, takeaway food only at cafes, pubs, and clubs. You got to feel sorry for the people in these retailers. Again, their businesses have been hammered. For the Easter long weekend, you know, because if they close over Easter, surely they would have bought extra food and stock to prepare. Well, elsewhere in Queensland, customers must be seated. Why? Because you can't stand? No food or drink orders taken at the bar. Oh, okay. Masks compulsory across the state when indoors but not in your car. Okay, let's just look at Google Maps. We'll look at Queensland. Now, this is Queensland, guys, for those of you that are not familiar. It's a very big state. Now, here, this is where Brisbane is. So people at Rocky, people at Longreach. This is the furthest inland I've ever been in Australia. Okay, I mean, I've been to South, Adelaide, but inland is Longreach. That's interesting, actually, when I think about it like that. I've lived on the coast most of my life. But yeah, they have to wear masks indoors in Longreach, guys. Will it even make it through the bloody desert to get there? It's a long flight, and the drive is forever. What about right up here, up north? Everywhere, all the little islands. Cairns, Port Douglas. Okay, it's a big state. But we're not talking, we're talking about fear here. Moves at the speed of light. So you got to wear it in your workplace, in shopping centres, on public transport and ride shares. So you get fined $200 if you don't wear it. So, schools and childcare. Greater Brisbane schools are closed except for students of essential workers. Childcare centres must remain open. So we did term 1 with Mina in a day school. And I'm going to Rachel, if we're dealing with this rubbish, where they're going to close it anyway, let's pull her out faster. Because we originally were going to give her, kind of half a year. She wanted a term. She asked for a term, and she's kind of gotten over it now. And because of all the renovations that we're doing, it's kind of a bit hard. But yeah, I went there actually for an open classroom day, and one thing I noticed in the room, that the sound levels were peaking at 91 decibels, guys. And what frustrated me is that they just put them all in this temporary library space, and they hadn't put any acoustic paneling there, and nothing, even some cheap foam they could have put on the ceilings to help mitigate it. And yeah, I wasn't impressed with the new approaches to teaching. I can see how they make life really easy for the teachers, but I don't think it's going to improve the quality of education for students. I saw the same thing when I was teaching at university. They're trying to cram all of us architecture students into one big room, and you'd be there tutoring and talking to them, and you couldn't hear a bloody thing. Maybe it's just because I'm getting old. That's it. So visitor bans extended to aged care facilities, correction centres, hospitality, disability accommodation across Queensland. 30 people are allowed in homes outside of Greater Brisbane. Fantastic. So, going back to this photo here. Why am I making fun of our Premier? Well, not really. I'm just highlighting an issue. And it's an issue that I, myself, have to deal with. And the majority of people have to deal with. Now, this is a CDC study. Finds that 78% of people hospitalized for COVID were overweight or obese. There you go. Now, I'm just hovering on overweight again. I've slipped up with my diet, and chocolate and carbs have crept back in. Probably because of all of the well, to be brutally honest, if Rachel slips up, I will slip up. I'll have to fall on the floor to keep those carbs away from her. But, yeah, so I've been naughty. So I'm overweight. But at the very least, I know now how I can control it. I just need to kind of behave a bit more, go more keto and carnivore. But this is the thing. Remember that young guy, the 25-year-old who was sick they took to hospital? He wasn't overweight. He wasn't obese. He'd probably be one person that wouldn't, if it weren't for all the media and the hype, he'd just stay at home. Now, here's the thing. If you're going to socially distance, what if the media said social distance away from anyone who is obese and anyone who is overweight? If your BMI is over 25, you have to lose some weight before you can go to visit a hospital, before you can visit an aged care facility. Do you think they would dare to say that? We're too woke now, everyone. That's the thing. And this is the, they know this. Our health officials know that obesity and being overweight is a significant comorbidity and will have a huge impact on the hospitalization rates of people. Look at this, nearly 80%. So why don't they warn against that? There's too many people. We're all bloody fat bastards, guys. We're all, and there's not. Here's the thing. Being overweight and obese is an evolutionary response to survival. It's a good thing. It's the ultimate. The fat you got on your body, guys, even under your whole skin, it keeps you warm, and it's the ultimate emergency fund. If you can't get food, you can survive the winter. Your ancestors were the ones that could survive the harsh winters because they had that emergency fund built into their body. So don't think of it as a bad thing. Think of it as that you're just, the result of survivors evolutionarily responded to harsh winters. But this is why I think they're going so crazy. Because they know that so many of us are at risk, and that would just flood the hospitals. Even with the mortality rate where it is, they'd still get flooded, and it would just snowball from there. And they can't. Could you imagine the crazy lefties going off about, how dare you talk about people being overweight? How dare you make fun of people being fat? I mean, this is something we can all control. I'd encourage you to look at Low Carb Down Under. Search it on YouTube. Watch some of the lectures there from the doctors. Look at the carnivore diet. Look at the keto diet. Get the sugar out of your life. Sugar and carbs, guys, you don't, look it up. There's not actually, you don't need any carbohydrates. It's kind of like a backup food when we can't get meat. And here's another one. Here's another interesting number. The Amish may have reached herd immunity, health officials say, without any masks or anything like that. So, an Amish community in Pennsylvania may have become the first group in the US to achieve herd immunity, a local health official claims. The administrator of a medical center in the heart of Lancaster County's New Holland borough, which is known for its Amish and Mennonite communities, estimates that as many as 90% of the religious families have had at least one family member infected with the virus. There you go. And how have they been going? What's their diet? What's their food? What's their obesity rate? What are they exposed to? And we'll look through these articles in greater detail on my HeiseSaysUS channel, but I just thought those were important to highlight because our leaders are obese as well, all of them. Yeah. And there's nothing wrong with that, guys. We've all got to deal with it. It's a common occurrence because we're living in the first world. We have access to a lot of food and a lot of the processed stuff that's around. Even just bread is full of seed oils, full of sugar, full of crap. So you eat it, your body goes fantastic, eat more of it, store that fat for that winter. So I'm not fat shaming people. I'm just highlighting a fact that obesity and just overweight is a significant cause, I would argue. I would say there's enough evidence to say that it's a cause of hospitalization with this illness. And that will put a strain on our medical services. So these are the things that we really need to be dealing with, because they'll have flow-on effects. If we could reduce the obesity rate here in Australia, if we could reduce the number of people that are pre-diabetic here in Australia, could you imagine how much would be saved in our healthcare system? So guys, there we have it. A lockdown, well, is expected here in Brisbane and a continuation of it. What do you reckon? How are you handling the lockdown? Is it affecting your lives? Let us know in the comments down below. We already homeschool and work from home, so it really isn't affecting us that much. I just can't get my Bunnings supplies for my demo work. Anyway, Thank you all for watching. Please like, share, and subscribe to the channel. Let me know your thoughts and opinions in the comments down below. If you're a fan and enjoy the content I create here, there are a few ways you can support us. You can join us on YouTube or Patreon. You can support us using our affiliate links on Amazon, eBay, Independent Reserve, or AussieBroadband. Take care, and I'll see you next time. Bye for now.